Oh, my volume's like really low. Hello, welcome. This, I'm Hillary, and this is the Pelvic Health 101. I hold this workshop every second Wednesday of the month, and I try to give it a little different aspect of focus each month, but this month we're really shifting to very much focusing on postpartum. So if you haven't attended my other months, I recommend next month I'm going to do my regular pelvic health 101 for women of any age. I do typically focus on childbearing age women, but that's a great basic. So today we're not going to go into as much depth into pelvic health and what that is, but more focusing on how you can restore pelvic health in the fourth trimester. So if you have questions at any time, pop them in the chat and I will answer them at the end, or I'll answer them then and there if I see it. But let me share my screen and we'll get going. Good to see you, Jenny. Thanks for joining. All right, share. Okay, here we go. I'm always like, what are you guys seeing? What am I seeing? All right, you see the slide up there? Cool. So postpartum consideration. So this is actually the first little workshop I did about, gosh, it's almost 2 years ago. I had to go back and tweak some things because it definitely shifted since I've worked with more clients. I think every client we learn more things, but this is a good one. It's something we glance over a lot. Okay, so a little bit more about me. I'm Hillary. I'm the owner of HV Holistic Health. I'm an occupational therapist by training. So most pelvic floor therapists are physical therapists, but there's a growing number of OTs. And what I think we bring to this space that's unique is much deeper training in mental health. And if anyone has worked around the pelvis or with birth, there's a lot of mental and emotional and energetic health aspects in the pelvic area in the womb space. So I think that brings a little special something to my work as a pelvic floor therapist, coming with that background in occupational therapy. I do birth coaching, more than just mindset. I just birth coaching, mom coaching, everything around birth and early pregnancy, birth, and early postpartum. And I've worked holistically for most of my career as an OT, and holistically just meaning really encompassing that whole person, body, mind, spirit, environment, social factors. So really looking at all my clients in a very well-rounded way. So I'm going to start off with what is optimal pelvic health? Because this is what I would say is the goal in postpartum or around any pregnancy, birth with pelvic health is pregnancy disrupts some of our pelvic health, or a lot of it, depending on how it goes. And birth certainly is a major factor to that. So in postpartum, it's like having this idea of where am I trying to get to? Like, how do I know that I went through this pregnancy and birth and I'm coming out, and I'm talking about a time frame of that whole year postpartum. By that year, if you can say you have most of this happening most of the time, you're doing pretty good in terms of pelvic health. It's not a clear destination, like you get there and it's good. Like there's so many factors, but it's not, I think it's good to give moms a reference of like, what would it mean to have pretty good balanced pelvic health? So first and foremost is like those physical aspects, like certainly strength and flexibility. So you want to have strength in your pelvic floor, but you also want to have flexibility. And we need that allows for that buoyancy, and we'll get to that a little bit more. So we don't just want a super strong pelvic floor, and we of course don't want a weak pelvic floor, and we want one that can move through those ranges. The other physical aspect way over here is equal forces and pressure throughout the system. So this kind of connects up here with your breath. So our pelvic floor is the bottom of the system, right? It carries the weight of everything above our hips. And without the muscular chair there, like everything would just fall out. So it's like a basket at the bottom, And it functions best when there's balanced pressures, both up, down, but all 360 degrees. So often with birth, what gets disrupted is the balance of the muscles. Not so much, a lot of people think like, oh, after birth, I'm so weak. Actually, you're not weak. It's the balance has been knocked off, and there's like pulling. One side's really tight, like maybe baby was jamming its head there for like 5 hours, and that side gets really kind of injured in birth. Nothing traumatic, but like gets worn out. And then baby comes out, but this side got so beat up, it stays in that tight and it doesn't balance out. And this can create symptoms. So that's that muscle balance. Breath and relaxation. So this is a really great way that moms can start to restore balance in their pelvic floor, is simply through good breathing practices and good relaxation practices. So I always am encouraging my clients to do something in terms of pausing in their day and like tuning in, like, where am I breathing? How am I holding tension? What is my jaw doing? Like really simple, quick check-ins kind of starts to chip away at this breath and relaxation. The middle right here is more about like coming to a workshop like this, learning more about your pelvic health and what that might be. If we don't know what it is, how do we work on it? Or how do we know what we could do? And comfort. Comfort is about you feeling comfortable enough to talk about your pelvic health, which when we go to the next slide, you'll see where with a lot of women, I see them just being hesitant because it's very personal stuff, or they're like, it's normal. Like, I've heard that's normal somewhere. I don't need to ask about it. I'm sure everyone has it, which is often not the case. It's always better to talk about it. And lastly, this is like a core tenet of good pelvic health. It goes much broader, into relationships, that I personally don't believe you can have optimal pelvic health without having at least one trusting and supportive relationship. And this does not need to be a sexual relationship, but it often is. It's often that partner. And your pelvic health and recovery or restoring in postpartum is going to be somewhat inhibited. Same with healing anywhere in our body when we don't feel safe, have that trusting relationship and support. And that's where that mental health aspect comes in. Okay, so what is pelvic floor health, or what are the roles of the pelvic floor? I'm going to dive down to the bottom here first, because this is an important thing to understand, is that your pelvic floor is the muscles, connective tissue, fascia, nerves that support optimal functioning of your pelvic health. So pelvic health is like all the systems. Pelvic floor is the musculoskeletal kind of nervous system. You can include the nerves in there, fascial system, connective tissues, but it's not the reproductive system, the digestive system, your bowels, the urinary system. It's not even, it's a little bit like lymphatic system. So all, and your cardiovascular system, we have blood flow through there, and even to your respiratory system, how you breathe, and I've already mentioned pressure influences it. So that is pelvic health. When all of those systems are in balance and working good in the pelvic bowl, we have good pelvic health. The pelvic floor influences that a lot, the musculoskeletal side. So hope that's clear. When I'm talking about elimination, intimacy, and organ protection, those are the functions of the muscles of the pelvic floor. So they need optimally, if they're working right, they are able to hold in and release urine, stool, and gas without unexpected leaks. Like, you can choose to pass gas with control, and then that's not considered a leak. That was intentional, or urine or stool, whatever it might be. So you can hold in and release when your conscious mind wants to. Elimination also includes babies, but that's kind of irrelevant. The baby's already out at this point. Intimacy. So intimacy is the ability to engage in pain-free sexual activity and attain orgasm. The orgasm isn't essential all the time. It's you have capacity for that. You've been able to do that. And then organ protection is how, what I mentioned with like that basket, the bowl of the pelvic floor protects and provides support for the pelvic organs, the reproductive, bowel, and urinary systems, and really all the structures up above that as well. So they need to have enough strength, but they also, if it's too rigid, like imagine falling on your butt on a cement basketball court. Ow, that's going to hurt. And so too tight a pelvic floor can be painful. Whereas with good buoyancy, it's imagining you fall on a trampoline. Doesn't hurt, but it has strength. So it's got this buoyancy. That's where we want our pelvic floor muscles to be, both for optimally for birth, but then if they weren't there for birth, getting them to in postpartum. All right, so I'm going to go through first the most common things I see or I get calls about in that early weeks. Get a lot of calls around 2 weeks postpartum for these. Leaking is probably the most common. Like I stand up and stuff just, urine, it's usually urine, is just flowing out of me. Like, is this okay? Is this normal? We'll go into that. Pelvic pain, that usually is reported a little bit later. I think there's some, obviously, because sometimes most, if not all women are not sexually active at 2 weeks and they're not realizing they're having pain with sex till later. But also just there's so much pain, normal postpartum pain from birth that would not qualify as pelvic pain. So you need some more time duration to really tease out, is this just normal, like you just gave birth and there's, there's some stuff going on, there's some swelling, or is it something more significant? Difficulty performing Kegels. I don't usually get people calling me about this, but this is something I usually will start finding, and it relates to that organ protection. We want that trampoline-like strength and flexibility. But I encourage, this is something that I think it's great for doulas to know about, and midwives are usually checking this, and the home births I've attended, they're usually asking women to perform a Kegel even just hour after birth. And that's great, but what happens like 2 days later when there might be more swelling? Can they still do it? Or 2 weeks later, 3 weeks later? So it's something to keep checking in on. And we'll go into this more, but I mentioned it's not just the contraction, it's also the relaxation. And for the untrained eye, that can be a little harder to figure out. But what's reported in terms of sensation can be your clue. Feeling of pressure, heaviness, a falling sensation. I recently had a client say it felt like a bubble, just like an odd sensation in the pelvic floor, the vaginal canal, the anus, any area around there. And they were just like, it just feels weird. And even more significant if those symptoms are more present when they're standing or sitting versus laying down. And constipation is another biggie, which is where, we're going to start with leaking. Okay, so super common. And you've probably seen, I even put something on my social media yesterday, like it's super common. It's never normal, but I will give a caveat. Like my instructors and mentors would be like, it's never normal. But in my experience, I'm like, it is so common in the first week or 2 weeks postpartum that I think saying that's not normal is just not setting the right frame of mind for a healthy restoring of that urinary control. I think you're setting up mom to be really upset that, oh my God, I'm damaged and this is never going to get better. So I say in the first 2 weeks to like just rest. And I remind moms, you should be mostly laying down anyways. And you're wearing pads anyways. And so just let your body do its thing. And I've had some clients who have talked to around 2 weeks and they're like, I'm still leaking. I'm like, okay, give it a little longer. The keys here is, are you showing some improvement? So if there starts to even be by 2 weeks postpartum, some increased ability to make it, or the quantity that's leaked out is reducing, or the number of times in a day, any measure of improvement, I'm like, okay, let's not jump to treatment right away. Because I've had a client at like 2 weeks, she was leaking every time. And by 4 weeks, she never leaked again. And I like consulted with her, really like do anything except educate that this is normal and here are some things you can do. Number one, staying calm, like really trying to get back to that. I should be relaxing, bonding, resting, healing, letting my body heal itself, and not getting upset about the symptom, because more often than not, it does just go away pretty quickly too. Staying hydrated. So sometimes I'll hear clients like, oh, I'm just trying not to drink as much so I don't leak so much. And actually, when you are dehydrated, your bladder is more spastic and you're more likely to have more leaks or more pressure, because instead of just like a nice releasing, it's actually muscle relaxation that allows urine to come out. It's not contraction. The muscle of the bladder is contracting. The muscles that hold the bladder closed are relaxing. So when you're dehydrated, that bladder muscle contraction is more like when you're hydrated, it's smoother, it's more comfortable. If there's leaking beyond the stage of wearing pads for the lochia, I suggest shifting to incontinence pads. And the primary brand of this is called Tenna. The reason for this is blood and lochia have a different consistency than urine. And the Tenna pads are made for absorbing water consistency, whereas menstrual pads are intended to absorb blood, which is of different consistency. So it's just gonna wick away that moisture better from your skin, which is important for reducing infections. Using the toilet consistently. So sometimes this is the simplest tip I give moms, like, are you going to the bathroom enough? And they're like, oh, I go like 3 times a day. I'm like, well, yeah, of course you're leaking when you finally go or get up, because your bladder is so overloaded. We should be passing urine every 2 to 4 hours during waking time. So if you have a mom, or you're a mom who is only going pee 4 hours after you wake up and start your day, that could be feeding into the incontinence. Contract the pelvic floor before exertion. So this is often like the common report I get early postpartum is, as I stand up, pee just pours out. And say, okay, before you stand up, I want you to try to Kegel and contract your pelvic floor and then stand. And this plays 2 roles. It's strengthening of the pelvic floor, kind of restoring that muscle awareness, and it can prevent the leak. And then maintaining a log of your symptoms. So how often are you going to the bathroom? Did you leak before you got there? The amount of it, is it just a few drops, or is it like full on, like the complete bladder empties? That's all informative stuff. And it's also a good way to monitor progress. It can be hard to remember things early postpartum. So writing simple things down. Okay. Pelvic pain. Okay. So pelvic pain is hard to tease out initially. So I'm talking, this is more towards like your 4 to 6 weeks postpartum and beyond. Because initially you have inflammation and swelling. So you want to do the usual recommendations, like either ice or heat, using the peri bottle, sitz bath, staying off your feet. That's going to reduce that post-labor pelvic pain that pretty much everyone has to some degree. I am a huge fan of heat for blood flow factors. Ice restricts blood flow. And so if you want swelling to reduce in your, where you just birth, around your vaginal space, your labia, your vulva, you need to be applying actually heat or just keeping the area warm. I'm not a fan of padsicles. They're like a quick fix. They actually can prolong that swelling. So heat, heat, heat to promote blood flow. Your blood flow is what clears out swelling, and that pain can go away a lot quicker if you're only applying heat. Padsicles, if you want to use them, go ahead. It's going to make it feel good for a little bit, but you might need to be using them longer than if you just applied heat. Now, if you have a perineal tear, that's going to cause additional pain. So early on, it's even more important, I think, to stay off your feet and avoid positions that are uncomfortable, which is commonly sitting. It's very uncomfortable. So when your body gives you that ping of that sharp pain, shift off of it. Don't be like, oh, I need to like stay here because I don't want to disrupt baby or something. No, your needs are first and foremost. Shift off of it. Good hygiene is really important. So using that peri bottle every single time to clean the area. Again, ice and heat can help. If you had pain medicine prescribed to you and you're really uncomfortable, yep, it can be helpful, and following your doctor's guidelines. So early on, you're just trying to encourage good healing of that tear. I will say though, once you hit about 6 weeks and at that 6-week appointment, more often than not, doctors will check and see if the healing is good. This is usually for a second, third, and fourth degree tears typically take longer than 6 weeks to heal. But that second degree tear, they'll say, oh, it looks like it's pretty much closed. That doesn't always mean it's an end all game. There still can be a lot of discomfort with it. And that's what I do a lot with my work in screening postpartum women. So I'm going to pause on that until a little later. But I always recommend women who have a second degree tear, and second degree tear, I describe as like the wild card, because there's such a vast variation in terms of how severe it is. Because a second degree tear is any tear into the muscle between the vaginal wall and the anus, but not all the way to the anus. So you could be, now this is hugely exaggerated in size, but say your perineum, that space is this big. So second, and this is your vaginal wall, and this is your anus, the wall of your anus. It could be this far, right? So it could just be that far in, or it could be that far. It's a big difference. And in the body, it is a rarely big difference. So the person who had a second degree tear like that might feel fine and need nothing. But one who had almost a third degree tear probably would benefit from learning scar massage to reduce pain when they return to sexual activity or just athletics or sitting for long periods of time. And again, you'll see a little theme here down below. I'm a huge fan of logging symptoms. Pretty much every consult call I do with clients, I'm usually asking in between that call, and if we agree that we're going to work together, to start logging their symptoms. So, because it's so informative of understanding, when does this happen? How long is it there? How severe is it? So I have logs for like pelvic pain and incontinence and constipation. So I think it's great as doulas too, to encourage tracking of symptoms. It's an easier way to gauge and a more objective way to gauge, like, is this person improving, or am I improving, or do I need to truly like reach out because nothing's really changing? Reach out to a pelvic floor therapist. And it can be, I think you sometimes come to that realization quicker when you have a log, instead of being like, well, what was it like last week? And you're like, no one ever remembers that much in early postpartum. Okay, early Kegels and core activation. So this goes more to the side of exercise. We're told like, don't exercise in the first 6 weeks. And I'm like, well, there's actually a lot you can do that is more about reorienting to your body and how it works, and starting to almost it starts with just in your mind, like, what am I feeling in my body now? Because especially with that first birth, it can feel really foreign and really different than it did before. And that can make some moms feel really kind of afraid and like, oh, okay, I'm not going to do anything. I encourage curiosity, and I embrace with my clients who are pregnant. I talk a lot about like, I want you to be curious. Things are going to change, but look at it as a new opportunity to learn about yourself, about your changing body, and like really embracing those changes, because sometimes they can, but I think flipping it to looking at it as an opportunity for growth and learning new things is going to set you up for better success than like fear of, oh God, what has happened now? Like my core is never going to work the same. It can work the same. It's going to work the same in a different way. Your Kegels will work the same, but they may feel different. Doesn't mean they're worse. Doesn't mean they're damaged. It's just different. So embracing different is a good place to be, and being curious, like, what does it feel like? And if it feels really uncomfortable or scary or painful, then you might want to reach out for more support. So Kegel and deep core activation within the first 24 hours. So Kegel is just trying to contract your pelvic floor and then seeing if you have control over letting it go. A lot of times in the first 24 hours, it's just like a whoop, whoop. That's all you guys, like a quick, what I call a quick flip. But that is good. If you can do that, those muscles are still like, yep, we're here. It might feel really weird. It could feel painful, but being able to do that quick, and even if you can't hold it, you get a thumbs up. You tried it, you passed. We'll come back to it tomorrow. As for the deep core activation, so this is activating your transverse abdominis, which is the deep corset muscle that is really, hopefully through pregnancy, actually stayed quite strong, and potentially, ideally, you were able to use it to help with birth. But you may not be connected to it at all. And it's also a muscle that I see often moms have trouble finding in postpartum. They're like, I don't know what happened. It just feels like a bowl full of jelly. So my cues that I give, the easier one is just trying to exhale really long. So inhaling and exhaling, because we should always be contracting on the exhale with Kegeling and deep core activation, and relaxing on the inhale. So I'll ask them to inhale and be like, okay, grow big, expand your belly, expand your chest, and exhale. And we'll see what happens. And if you can see their soft postpartum belly like come down a little, and saying like, okay, do you feel some tension deep in? That's a thumbs up. You're not feeling for like a tight core. I mean, no, if you've had babies, you know, postpartum bellies are jelly. But you're feeling for like, does that mom get the input into her brain, the sensation of some tension? Doesn't need to be tight or strength. The other way to cue it is pulling your hip bones together. This one sometimes comes a little later to really cue into that. But those sticky out bones in the front of your hips, and okay, when you exhale, you try to pull those bones together. That's also an access point for feeling the transverse abdominis, is like, so your sticky outy bones are here, belly button's up there. You put your fingers right inside that bone. Sometimes you can feel that muscle contract. And that can be like, feel good. You're like, oh, something is happening down there. And a contraction, just like the Kegel, can be a twitch. It can be like, you feel like here's the blobby muscle and you feel like, oh, burp, burp. And it's just like a quick something. It's like, hey, it's there. It's responding. And we'll work on increasing strength and coordination over the next 6, 12 weeks, even months. So reminder, Kegel with the breath is exhaling engage and lift and tighten. Inhale, relax and open. It's the same cue I use for abdominal contraction. It does not change. It can be different than what women were using, especially if they didn't work with me in pregnancy. A lot of times when I start working with clients, they're having to flip their breathing pattern. Continue to perform both of these daily over the first 2 weeks. So it's a check-in. It's not exercise. It's like, okay, what is my Kegel doing today? I do encourage trying it in different positions, like laying down, day of birth is what I would recommend. But like after day 1, 2, 3, can I feel it when I sit? Can I feel it when I stand? It's going to be a lot harder. And it's okay if you don't feel it, especially if you're feeling it when you're laying down. When you're laying down, gravity is not impacting those muscles. You're more likely to feel it. When you sit, gravity is impacting it. And when you stand, there's even more pressure. So it may take a few weeks to feel anything in sitting or standing. It may take a few months. Focus on the supine in terms of knowing the sensation, but don't stop trying the sitting or standing. And I'm literally talking about trying once or twice here, not reps, not sets. Okay. Oh, all right. I thought I had constipation first and it's last. So I'm getting confused when every slide pops up and it's not constipation. All right. Pressure and heaviness in the pelvic floor. So the reason I talk about this is it is the primary sign of pelvic organ prolapse. Or birth. Yes, it's also a sensation of birth. I don't know why I have that in there. That's kind of funny. But what is pelvic organ prolapse? It is a shift of an organ, typically the bladder, can be the rectum, can be the uterus, can be all sorts of pelvic organs. But the primary around birth is the bladder in the front and the rectum in the back. And say baby's coming down and they are OP, so their head's more in the back of their heads, they're coming out face up. They really can like drag the rectum with them a bit and cause that rectum to just kind of shift from where it's supposed to be. Doesn't mean that it's falling out of you, because you have to remember how the anatomy is. Like your vagina is a tube and the rectum is a different tube and the bladder is a balloon. They're all separate. So the sensation often, that's why I have this, like the common thing is like, is something falling out of me? Most often, like 99% of the time, postpartum, no, nothing is falling out of you. Now, scenarios can change with everyone, so it's not 100% no, but chances are no, it's not. But it's a shift in sensation that your brain is trying to interpret and it doesn't know what it is. And it just you'll receive a sensation of pressure, heaviness, that bubble sensation I received the other day was a new one. I feel like something's off down there. It just doesn't feel the same. And I think the most important thing to know is start to recognize, when does this happen? Does it happen when I'm walking and standing and reduce when I'm resting? That is something to get checked out. Or is it just there all the time? Is there all the time? You know, it's still, I think this is a symptom, I guess I should say. It's always something to get checked out. The primary thing to do, especially in those first 6 weeks, is just you really need to rest. So our body is amazing at healing itself. And so a woman who just rests and truly tries to stay off her feet for those first 6 to even 8 weeks, which is so hard. And I don't want to just sound like, oh, we'll just rest and we'll be fine. Your body will heal. I know it's really challenging, but it can be so impactful to helping your body heal and restore. So if you're having this sensation, like I just stress it more because what I've seen is had calls with women around 2-3 weeks with this sensation. I'm like, it's rest, 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 rest. And by the time they come to see me, maybe at like 6-8 weeks, their symptoms have improved drastically. So now I'm working with a body that is also working with that mom. That body has already done some healing, and your body can do amazing things. So let it do its thing by resting. Then for the remainder of that sensation or symptoms, working with a professional. If you're not able to rest and you're really up on your feet, there's just going to be a lot more to do with a therapist. And I say, let your body do its magic first, and then working with a professional later on. Because I think I've given multiple examples already today that allowing your body time in postpartum can heal so many things that then you don't have to worry about going to a pelvic floor therapist or going here and there and all these places to be supported in healing. The body is amazing. Okay. Well, Kegels make it better. So often if you report this to a doctor, what they're going to tell you to do is Kegels. And okay, it could be helpful. And the theory, if we think about, okay, well, why are they telling me to do Kegels? Well, a Kegel contracts your vaginal wall, right? So you're making that tighter. And the idea is like, okay, if the rectum is bulging in and you Kegel it, like, will it like push it back? It might, but it's not really approaching the problem in the way it actually is occurring. It's usually related to more intricate tensions. So when you Kegel, most people Kegel, they're not like, you have 14 pelvic floor muscles. They're not like, I'm gonna flex muscle 1 to 4 only. You can't do that. I can't do it. Most people can't do it. And when you work with a pelvic floor therapist, they, with using manual techniques, meaning fingers, can help relax. So when I feel inside a vaginal wall at the musculature, I can feel areas of tension and areas of it being very soft and maybe very lax, like very weak. And so I can work with you in balancing that out. And that balancing out of the pressure and tone in the vagina can actually help the rectum go back. So it's more intricate than just a Kegel. So what does help? Not freaking out, resting, knowing that your body is smarter and more capable than you've ever known possible, although you might have new insight to that after birth. And also a personalized, where your prolapse is, how much it is very individual. No one's going to know until you're working with a pelvic floor therapist. I've never felt 2 prolapses that felt remotely the same. So it is a more customized approach, but it usually involves that manual work I mentioned, posture, improved abdominal pressure, like how you're moving pressure within your body is so vital, and some strengthening, but not always. Sometimes prolapse can occur actually because there's too much tension in the area. All right, constipation. This is honestly the thing that worries me the most in postpartum for pelvic health, because it's so common postpartum. And I say it needs to be addressed ASAP and ideally and hopefully resolved or greatly improved within 1 week of postpartum. So doulas and midwives and anyone who doesn't have a doula or midwife being informed about postpartum bowel and constipation and what you're eating and how you're supporting the flow of your bowel is like so important, because it adds pressure to your pelvic floor when you get all that back up. And that in like this more delicate, I don't like to say weakened, but more delicate state, like your body's got, that whole area has gone through some trauma of a baby coming through it, and it's already swollen, it's already, maybe has a tear. And now you just back up your bowel on top of that, the amount of pressure in that area is so significant. And things are, so when you're pregnant, you have pressure, but it's kind of like this perfect balance of pressure. And now you have that release. So like you don't have all those fluids in you, and there's a lot more laxity happening. Instead of like a full balloon, you got like a deflated one. And so things can shift and move a lot easier and are more impacted by that pressure, if that makes sense. So this is why I'm like, you need to pass. Now, we don't want you straining. I'm absolutely not saying that. Straining is probably the worst thing you could do. We need it soft stool. So hydration, 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 hydration is number one. Fiber is good if you're not already backed up. If you're already backed up, do not add fiber. It bulks your stool more. You want to hydrate. There's supplements like magnesium is going to help you. Psyllium husk, liquid chlorophyll is something I learned from midwives that I think is amazing. Belly massage. So I will send, I think I have a video or a good picture of belly massage, but you're basically working from the left hip, the same as you do on babies. So it's good to learn on yourself immediately postpartum. You can do it on your infant when they get locked up. But you start from your right hip. You're moving to your left hip up to your, left hip to right hip, up to right rib, across to left rib and down. So it's in a square. And then you can also do star-like strokes in towards your belly button, just in. Breathing. So when you're trying to pass, instead of, we don't want any straining. We want to exhale, breathe, just like you may have been coached to like breathe your baby out. You want to breathe the stool out. You don't want to be straining. And a squatty potty is good if you can tolerate that pressure. I know personally postpartum, I was like, hell no, like everything's gonna fall out of me. So squatty potty was not working. But what I focused on was hydration. And also, this is another reason to, if you need pain medicine postpartum, and you need it, but trying to take the least amount that you need, because pain medicine is going to constipate you horribly. And so you may have received some during labor, you may have received after labor, but really trying to like minimize for the sake of your long-term pelvic health and flowing of your bowels. Okay, also movement is going to be good. So there's that balance of movement and rest. All right, so pelvic health in week 0 to 2. I've kind of touched on a lot of this already, but just to give it to you in a different way, instead of problem-based, like what do I do in week 0 to 2? Ask for help, have help, hire help, make time. Resting. This is where you're trying to encourage your body to heal and restore. So staying off your feet, that's going to be helpful for your bladder. It's going to be helpful for any shifting of your pelvic organs. It's going to be helpful for healing of a tear. So many reasons to stay off your feet. The daily Kegel and core activation. So linking your breath with that pelvic floor and core activation. So inhaling, you expand, you rest, you're not contracting. Exhaling is when you're trying to engage. And you don't need to do the Kegel with the core. You can separate them out. And then just supportive repairing, sitz baths, keeping the perineum really clean, ice or heat, bone broth, easily digestible foods, soups, and hydration. So not much there. And then moving to week 2 to 4, this is when a lot of times moms start to want to I want to move a little bit more. So I say it's really initiating movement, like more than the essential going to the bathroom, bathing, eating, caring for baby, like a little more movement. Okay, because I know for me, like my body was just starting to feel like achy. Like I feel like I'm disintegrating. It's okay. You know, it's what is going to be your guide of what is okay is what's coming out of your body. If your blood is increasing, your passing of lochia is getting more bloody or bright red, that's a sign that your body doesn't want to do that. So it's really, your body is going to tell you what you can tolerate. But I talk a lot about organic movement routines. So it's just like standing up. It might be like dancing for you, or it might be just like, I just need to like stretch and move, roll around on the floor a little bit, whatever feels right. Like keeping yourself time limited. I'm a huge fan of timers when you're starting to do exercise or movement in postpartum. So 5 minutes that first day. And then waiting 24 hours. If you didn't have any change in what is flowing out of your body, what looks the same or is improved, improvement meaning becoming darker, more yellowy, more clear, to and reducing in quantity. If you're returning to brighter reds or increasing in volume, you need to do even less the next day, not the same, less or nothing. But if there's no change, then like the next day go like 7 minutes and just organic movement. Walking is good too. Building that mind-body connection. So starting, and this is where I think starting to move, we start to like reconnect to like, where the heck, what is my body doing? How am I feeling? So making just observations about how you're holding yourself. I will include, I always send out an email to all of you, everyone who registered. I'm going to include my video tutorial of mountain posture. This is really great to start like checking in, like, where am I in space? And so with mountain posture, real quick, is like trying to align in your standing, your ears, your shoulders, your hips, your knees, and your ankles. And, you know, I talked through like where to contract, where, and it's a very strong posture. So it's a yoga pose. Most of you have probably done it. It does seem like you're just standing, but when done correctly, it's very active. And it's really great for like reminding your body where it should be after having gone through a huge experience of birth and early postpartum, where your body's probably moved and done things you never knew it could do, or you've been in really awkward positions. It's great to start a practice of just returning to neutral and starting to see like where do I feel tightness? How hard is it to get there? Can I not even tell what I'm doing? Do I feel very disconnected to my body? And also a neutral pelvis. I don't have like anything near me today, but neutral pelvis is when your pubic bone and your ASIS, the sticky outy bones, are on the same plane. So in pregnancy, we tend to shift anterior tilt or posterior tilt. Everyone's a little different, but we want to try to restock them. So I will also include that video of like how do you find a neutral pelvis? Continuing the daily Kegel and core activation. And then since you're moving more, it's a really important time to start not just activating and knowing that your core is working, which is what this one is, but protecting it. I learned this after my second, when I destroyed my core. I don't think in pregnancy, we all have diastasis in pregnancy by the end. If you hit 36 weeks, 37 weeks, you have a diastasis. It's what you do in postpartum that helps it heal or restricts it from healing. Sometimes in birth, like multiples, and like everyone's body frame is different. You can have a really severe one at birth that might have a trouble healing, but I think more often than not, it's women not connecting to their body soon enough, and they're adding pressure to their weakened core system, the muscle, and it's creating a more severe diastasis or not allowing the body to heal well. So the number one thing you can start doing is blow before you go. So before you pick up baby, before you pick up the laundry basket. You shouldn't be picking up anyways at this point, but you have to do laundry. It's been 2 weeks and you haven't had help. Blowing exhaling, not even worrying about what you actually feel in your body. If you exhale forcefully, you will have some contraction of your deep core. So don't worry about what you actually feel, just getting in the habit of, I'm about to lift up this car seat. I'm going to, before you pick it up, not as you pick it up. Okay. So that happens pretty quick in our body. Okay. Pelvic health in weeks 4 to 6. So just increasing slowly. I kind of talked about that on the last slide, like again, or getting some gentle yoga, or maybe starting more of a walking routine, but you're increasing in very small increments, like definitely no more than 5-minute increments each day, more like 2 to 3. And based off again of, are you what is coming out of you? Okay. So what really has changed here? So this building the mind body connection, going to mountain posture each day. Are you starting to be able to understand and find your neutral hip position? Same. You're just continuing to work on that. What that practice is doing is helping you know where you are in space when you return to more formal exercise. That's going to help protect your body from injury. So if you're understanding where neutral is when you're starting to do more complex movements that exercises usually, you're going to be more able to protect from injury. And that's what this stuff also is working on. So if you've been working on Kegels, it's not been a month. Okay, you've been like a handful of Kegels a day, and you're like, okay, I can feel it contracting and I can feel it relaxing. Well, now you could expand on that. You could start doing more like quick, just contract and release, or holding. Can I hold for a count of 5 and then release? I want to emphasize that release is just as important as the hold. Because if we're always exercising holding, we're creating a really tight pelvic floor. We need to be exhaling to release the tension, just like you wouldn't keep doing a bicep curl and never release the arm. We need to release. So the release in the pelvic floor, sometimes where moms need to actually focus more. They got the hold and they could like hold it there all day. They're like, well, don't hold it all day. Max of about a count of 10. That's all you need to do. And then make sure you completely melt and release. I'm always doing like, the analogy I really like is if you think of a jellyfish moving through the water. So when it's soft, this is the release, and then it moves, it contracts. And then it opens soft and it contracts. So this is the pulling up contraction of the Kegel, and this is the releasing of that Kegel, and it's soft. Heel slide. So I will send some pictures or video of these. The email is going to have a lot of extra information in it. But heel slides is just laying on your back, knees are bent, and you're sliding your heel out. And as you exhale, you're bringing your knee back to bent. Inhale, other leg out, exhale, in. Because the exertion of that movement is on the in. So it's just like blow before you go, blow before you do the exertion. So knees are bent. Inhale. Exhale. A great first. Let me wake up my core. I want to start really exercising. I'm hoping to get cleared by my doctor at 6 weeks or whatever. I want to get back to activity. Get your core woke up first. Waken. I don't know what the right word is. Wake up your core first. Okay. And a hip rotation. So this is, you're bringing your knees to one side. Okay. That's easy with gravity. So you inhale. Now to bring it up, exhale, and I blow, feel my core kind of engage. Exhale, bring it back up and to the other side. You also can just hang out there because it feels great. You're in like a twist, right? So you're trying to keep your shoulders flat on the ground. Your knees are going side to side. Exhale on the up. Inhale, exhale on the up. Okay. Quadruped. So this is the technical term for all fours. So getting into all fours and trying to keep your, Jenny had to go. Okay. Quadruped on all fours, keeping a neutral spine, and you're just pretending to lift up your hands or your knee, one of them. So the action of pretending to lift engages your deep core. It's a really cool exercise that is very simple. You could have baby under you. So you're kind of looking at baby, getting that FaceTime with them, and you're on all fours and you're just not lifting your hand off the floor, but you take the pressure off. Now, when should you exhale? When just before you unweight your hand or you unweight your knee. And then birthday candles. This is also done on all fours, and you're just sitting there like you have a birthday cake with 50 candles in front of you, and you're blowing out all the candles. So if you do that with me now, you're inhale, expand big. I mean, you can do this in any position, but on all fours is extra good because you feel that lifting of the core. And exhale. You should be feeling your core hugging and pulling in. Okay. Before you go to what is typically scheduled as your 6-week checkup with your doctor, I recommend women doing a vulvar examination. And this is really just a visual check with a mirror because it's on yourself. And it's kind of reorienting you to what is going on down there now. Now, every client I work with, and I love working with pregnant women because I would tell them, I want you to do this before you give birth, and you're going to do it again after you give birth. And it's not, I want to approach it as this is informing you about your body. Your body is going to change and shift, and the pelvic floor, the external genitalia, what you can see from the outside often does look very different. But it can be helpful in explaining to you why things feel different. Now, different doesn't mean bad. Different is just different. And it's starting to embrace like what has changed about me. And this goes to your sexual relationship as well, because there can be need for new exploration in what feels good in postpartum. So I always recommend exploring yourself, learning about your new body before re-engaging in partner sexual relations, because it's helpful for success and enjoyment of partner sexual relations to understand your own body. Can't expect him or her to understand your body better than you understand your own. So learning about and seeing, okay, what does it look like down there? Now, if you never did this before pregnancy, that's okay. You can still look and be like, okay, I see where my vaginal opening is. I see where my perineum is. I see this, everything, and you're touching gently. And you may notice you have tender points, especially that perineum between the vulva and the anus often has tender spots on it. So now you know, and it's kind of outside the scope of this workshop, but there's ways to reduce that tenderness. This also can be helpful going to your doctor and saying like, oh, I was looking down there and this looked really different to me. They've seen you down there. And they usually are going to say everything looks fine, because everything probably does look fine, but it's just different and new for you. But it's good to also write down any concerns you have, like, oh, I noticed. And it can be what you saw with the mirror. It can also be what you feel. So touching is an important aspect, touching all around the outer lips, the inner lips, up near your clitoral area and your urethra, down around your vaginal opening. If you're comfortable, you can even place up to a first knuckle in your vaginal opening. It's totally safe. even safely 2 weeks postpartum. It just can be messier then. And feeling is there tenderness in anywhere around there, and then going down to the perineum, is there any tenderness in the skin space between my vagina and my anus, and then even around the anus, but always end with the anus. Let's start there. So you work top to bottom. What does it feel like? Where is there tenderness? And bring any concerns you might have to a doctor or a pelvic floor therapist. Okay, so recognizing when and why to seek out further support. So I have, if you on my social media links, access to this pelvic health self-screening tool. So it's, I think it's like 10 or 11 questions. And based off of, if you're checking 3 or more of these, there's definitely a reason to reach out to a pelvic floor therapist. So you might go through this initially right after giving birth, like 1-2 weeks, and then again at like 4 to 6 weeks. And if you're maybe within 1-2 weeks, some of them are NA, like sexual activity. But so a lot of them will be relevant right away, and then returning to it like 2 to 4 weeks later. And has it improved? Your body's healing. Like maybe there's not a reason to reach out to a pelvic floor therapist right now, or there is. So that's a good jumping off point. So just find me over on Instagram and click the links, and that's for free. So something I really encourage is postpartum pelvic health screenings. So I think postpartum care is not complete without a pelvic health screening. So I do these, they're half-hour visits. They're really quick. They're really very like the essentials of what I think every mom should receive in postpartum in terms of pelvic health care. I really wish that every mom would have covered by insurance 3 to 4 pelvic floor visits covered. That's not the world we live in. This is whether or not you have symptoms. This is for a professional to do a more thorough and complete check and say, hey, you're doing great. Everything looks good. Here are some ideas of exercises for some areas where you might want to focus on, and you go on your merry way. Or you confirm that, yes, indeed, you do have a prolapse, and that should be treated through formal pelvic floor therapy. Or you do have a lot of pain in your perineum or in your vaginal canal, and that could disrupt your enjoyment of sex or exercise, or just day-to-day activities. So it's really, before now, I don't even do these questionnaires anymore. It's just an intake form, gives me a lot of information about how your birth went. And then during it, I'm mostly doing external things, mostly looking at your posture, checking your core, how are you engaging it? I do looking at the external genitalia, pressing all those points I just suggested you touch, seeing if there's any pain or discomfort, doing an internal Kegel test, just asking you to contract and relax, and doing a prolapse screening. I really prioritize the prolapse screening because OBGYNs are just not doing it. Even with symptoms, they're doing it only in supine, laying down, and you can't definitively really diagnose a prolapse in laying down because often they're way more severe when that person just stands up. So in supine, laying down, you might say, oh, you don't even have a prolapse. But then when they stand up, okay, now they have a second degree and they do have a prolapse. So I always do the standing one as well. Okay, next up. So if you do need pelvic floor therapy, next is a pelvic health evaluation. This is where we go into a lot more depth. I always credit anyone who's seen me for a postpartum screening. I credit what you paid during that postpartum screening towards your evaluation, because I've already done a lot of the evaluation actually, but this is just getting a lot more detail into exactly what is going on and what your goals are and what you want out of pelvic floor therapy, and it sets the plan of care. All right. I like to mention, I do have a course called Pelvic Health Essentials. It's currently not available, but I'm re-releasing it in a self-paced format in early 2023. And it's really for pregnant and postpartum women who really are like, I want to take control of my pelvic floor. I want to know all there is to know about it and how I care for it myself and what I can do to reduce the risk of developing pelvic floor problems later on in life or after birth or whatever phase it is. So it's really the detailed information I wish every woman got. These workshops are like the cut and dry absolute essentials. Pelvic health essentials goes a lot deeper for those moms who are really, really wanting to take control of their bodies and their pelvic health, just like we know what we need to do for good oral health, for good heart health, for good eye care. We know we were taught this stuff, skincare, but we really weren't taught about pelvic health at all. So there's 6 modules. There's a 6-week course. Each week you're released a new module. And it's about an hour a week of coursework. And there's a lot of activities and exercises that you're hopefully doing throughout the week incorporated with it. All right, and just a few other ways you can work with me or interact with the work I do is joining my email list. I send out an email every Wednesday. It's called Mama Wellness Wednesday, and it just is 3 things. There's 3 things related to birth, postpartum, mom life, pelvic health, general women's health every week. So it's a real variation. And every Thursday I do live chats on Instagram, either just about a topic of the week. Sometimes it correlates with the Wellness Wednesday email, and other times coming up, I'm actually going to be doing chats with other birth and women's health professionals. So join me through there. I do these free workshops every second Wednesday of the month. And I also do coaching. I am a women's health coach, birth coach, postpartum coach. If you're really wanting more personalized support in getting back to your health and wellness goals as a mom, as a pregnant mom, that's what I do. That's my passionate work, where I really bring in all my knowledge I have, and we work together one-on-one. So you can find me on Instagram and TikTok at HB_holistic health. And thank you so much for watching and tuning in. I appreciate you spending the time, and give yourself a pat on the back for taking some time to take better care of yourself. So I am going to stop the recording.